So let's look back at our polling questions. We're going to pose the same 2 questions again, just to see if there's any shift in response. So let's look at this first one. Is there a need in Canada for accreditation and health promotion as a profession? And it is okay to still say no. And again, if you've got some thoughts about your responses, you know, maybe especially from anyone who has said no, it would just be really interesting to consider that perspective. There's room for all opinions and perspectives on this in this discussion. So that will really help inform next steps going forward if you're comfortable sharing, either in the chat box or privately later on. That would be really helpful. So that's very interesting. And then let's look at the next one then. And that is, would accreditation enhance the integrity of health promotion as a profession? So that's interesting. Maybe a few more maybe. You know, I know we can close the poll. I know that for me, the comment around accreditation making the profession exclusive when health promotion is really built on inclusivity, and that there's some, I had not even begun to think of that as an aspect or as a perspective or consideration for whether to accredit or not. So I think there's a lot of actual considerations here. So we've got a couple of other polling questions that we do want to ask. If health promotion accreditation or accreditation of the profession were to go forward, you know, what organization could be the accrediting body? So there's, you know, there's a process and the pieces that get put together to have accreditation be awarded, but there needs to be a host organization. So who could that be? So this is an open text kind of answer. So we're seeing Health Promotion Canada, Public Health Agency, Ontario Public Health Association, PHA and FAC, Health Promotion Canada. Well, it's down to a three-way race right now. These are all, you know, really logical go-to organizations. More coming in for Health Promotion Canada. Health Promotion Canada. So this is really helpful. Oh, NCC. There you go. There's 6 of them. So if you want to be more specific in the chat box, that might be helpful. And maybe, you know, there is the umbrella NCC Public Health, right? The umbrella organization. It's really helpful. Thanks, everybody. I think we can close that one. This is really going to help our Health Promotion Canada folks and our IHCP partners to think about, you know, what could be the next step. And I think that might have been, yeah, I guess that was our last polling question. I thought maybe there was another one stuck in there, but I guess that would be it. I'm just going to do an extra, yeah. So I think that takes us to our Q&A period. And encore, si vous voulez poser les questions en français, that would be fine. We will have José available to help interpret some of those responses back so I don't miss anything. But that is an option if that's your comfort level. So we do have quite a few questions actually coming through, and I'll ask our speakers to be ready to go here. Our first question is, it came in when Leanne was speaking. What sort of uptake for individual accreditation has there been overall in Canada specifically? Leanne, and then anyone can respond?
Hi, yes, so in Canada itself, there hasn't been that much uptake so far. I think partly because we're still relatively unknown here as an organization, and because the system is still fairly new, everything considered. It was launched 4 years ago, and then we changed continents, so it was while it is one of our core activities, it's something that we didn't necessarily actively promote up until now, and so that's part of the reason we don't see higher numbers. But if you want to see who's actually registered and who's which courses have been accredited so far, it's public information that's on our website, iuhb.org, and you can see like who the individuals are, where they're from, and which programs have been accepted as well. So it's fairly easy to look up. Okay, so that's that question.
So that's good. And then
is that okay?
No, that's
yes.
Great. And is there a continuing education credit requirement? So once someone is accredited, is there a continuing ed requirement?
Yeah, there is, and I want to give a slightly, but the answer is yes, but I want to give a slightly longer response to that. I mean, we recognize that not everyone who does health promotion is in the health system. We recognize that not everyone comes from a health promotion program specifically. So the system is quite inclusive in the way that it treats, you know, health promotion and who it recognizes. So we do place quite a bit of importance on experience and on ongoing professional development. And that's part of the reason why, too, that we have this 3-year limit. We don't want to keep people on the register indefinitely. You know, some people might change jobs and might no longer be working in health promotion, and it helps us make sure, in fact, that people do continue over time to consolidate their skills, to develop their competencies, and so on. So yes, there's a component of the assessment that looks at professional development when it's time to renew.
Okay. And what's the registration fee, and how long does that process take in general?
Yeah, so the process can usually takes from one to about 3 months. In the past few months, it's actually been slower, just because we've been quite swamped with other priorities in the midst of this pandemic, as I'm sure a lot of people can relate to. But generally, we try to keep it fairly short, a couple of months turnaround time. The fee is in total around $200, and that's for the 3 years. There's a fee of approximately $50 that's paid up front. And then, you know, you don't pay any more than that if your application is rejected, but you pay the remainder of the fee if you're accepted and want to appear in the register. So that would be the fee. It's a slightly less if you're an IUHB member.
Okay. And another question around, sounds like a little bit about, actually it's not logistics, it's in general, and so this is really for anyone to answer. It's around the meaning of accreditation, I guess, in a sense. So, you know, individual accreditation would be interesting, but if workplaces don't acknowledge the designation, what does that mean? So I'm assuming, and you know, if the designation isn't then required or valued as a qualification, for example, for a particular position, or if there aren't any designated professions, what does that mean in terms of, and how does that relate or strengthen or weaken the need for accreditation? Anyone?
I can answer that. Sorry.
Yeah, go ahead, Chris.
Yeah, I just know that in the States, it is really directly linked to the workplace. So when they're hiring people, that they have an accreditation of some sort. I'm not sure about the International Union, and with what I looked with in Australia, and I think there's a person online that can probably answer it way better than me, is that it is linked, but not specifically linked, right? Like there are job postings, but I did not see postings that they wanted you to have this accreditation. Whereas in the States, pretty well, they want you to have an accreditation. Leanne, can you answer more of that?
Specifically around the US, not so much,
Oh, no,
but
I meant,
my thought, sorry?
I meant with your organization, Ireland and Australia.
Yeah. Oh, I see. Okay. Well, yes, perhaps within those contexts, it's recognized, but in the context of Canada, what I was thinking when I saw that question was that, well, there's an opportunity to exercise our advocacy competency, being part of the health promotion core competencies, and to sort of advocate for, recognizing the unique skills, the unique competencies that health promotion brings, and to get that, and to advocate to get that better recognized by employers inside and outside of the health system. I think that would be probably a goal in and of itself.
Okay. Thanks. Thank you.
Yes.
So I'm just looking down our list of questions here. I'm losing some questions here, so hang on. There we go. Internationally, so sorry, thank you for your patience, everyone. I was having trouble here with the scrolling. Is there any precedence for different streams in terms of accreditation? So one focus more on social determinants, one focus more on healthy public policy, another one on education, health education, that is lifestyle behavioral focused in terms of accreditation? Or is it general health promotion accreditation?
What we have, I think, oh, sorry, Leanne.
Yeah, no, go ahead, Chris. Go ahead, please.
From my perspective, what we were presenting it was general health promotion because it's about the competencies and skills that one has to do a health promotion job within that work. So whether it's a different topic or area of work, you still would have those competencies and skills to work in that area. That's what my perception is. Leanne may have something different, or Irv, that matter.
Yeah, that's a great answer. I agree with you. I think that no matter what we look at, we'd want to see all competencies represented. But that being said, for example, when we accreditate courses, some of them may have a focus on one of these areas that you mentioned, that's mentioned in the question, and that's fine. I mean, as long as we have a sense that the program is generating sort of rounded out health promotion practitioners, there can be different areas of specialization within those programs, and that's fine. But there aren't specifically streams in the process for these topics.
Yeah. It's interesting. So, I'm a dietitian. I'm a registered dietitian, and we are overseen by a regulatory college, provincial regulatory colleges, which I realize is slightly different, but I guess aligned with accreditation. And there isn't different designations in terms of licensing, depending on focus and specialty either. There isn't, and I don't think there is with nurses either. Although there are positions that are public health nurse, that I think the license to practice, or that the designation is, across specialty. So I wonder if there's, there's a relationship in thinking, that way.
This is Irv. My thought is that this is an issue that maybe could develop as we move forward here. I think at this point it doesn't make sense to be so specific in terms of accreditation. I think being accredited in health promotion is a good start, and there may be groups within the system over time that see that they need to have a kind of accreditation for the specific kind of work that they do. And I guess school health might be one that's maybe on the verge of doing something like that.
Well, and I'm just seeing a note from Tia in Australia in the chat box, and she's saying in Australia they haven't found a need for different streams because it's a competency-based approach, not a right. So,
well, I guess what I'm saying is we should stick with that if we're going to go forward for the time being, at least.
Yeah.
Irv, I would agree with you. Having worked in many different fields, it is about the competencies and the skills and the responsibilities that one's able to perform, regardless of the setting they're working in.
Yeah, but if we had this kind of organization, people who are on the same track as others can connect. So it might facilitate people doing that on their own, which is fine too.
Right. Okay. We've got another question around beyond, or actually, sorry, the becoming accredited, not the ongoing continuing ed. So if accreditation does happen, and new grads of health promotion programs would be eligible to apply, would there also be a space for previous grads of accredited programs to also apply as an accredited practitioner, and how would that work? So I guess, if someone was a student in a program before it was accredited.
Yes. The way that our system is set up at IUHPE, you're only automatically eligible to register as a practitioner if you graduate from a program that's already accredited. So there's no there's no clause to say that if you graduated last year from a program that becomes accredited this year, it doesn't work like that. But again, anyone who has the combination of training and experience can apply. Applying from straight out of an accredited program ensures you eligibility, but many other people can successfully register as well.
Okay. A question and a comment around reaccreditation in every 3 years. And so what is the rationale behind doing it regularly and
yes,
regular
that's
intervals,
part of what I was
so
saying
frequently?
in the response to the professional development question. I think it's important to continue to show over time that you're still working in the field, and that you're continuing to learn and to develop your competencies. So that's why it's really a quality issue, a quality control issue.
Okay, no, that's great. And I know that's the case when I was working in frontline public health, and there were public health accreditation programs, for example. Those were also done at regular intervals for the same reason. And the research changed, and the function of the profession changes, and the standards that we're held to as practitioners also changes. And so I think that makes sense from a continuing quality perspective. And so we have a question about public health nurses and how public health nurses fit in. So there are some who work in healthy schools, and I'm a dietitian, and some of the roles that I've played have had health promotion components. That's
within
where
our
health nurses fit in.
Who's was that, Chris?
Can I
Yeah, if you have a
jump in there?
perspective, please go ahead.
Oh.
Okay, just
Yeah,
from
it's okay. You can go. You go ahead.
yes, okay,
I
great.
can just answer how it happens in the state.
From our perspective at IUHPE, I think public health nurses could very well fit into that model. And certainly if you're doing school health work, if you're working in any way in a sort of healthy schools kind of setting, then there's a fairly good chance that the competencies that we've outlined here are things that are exercised on a regular basis. So the important thing really is to demonstrate training and experience as they relate to the core competencies. So if you can show that you're doing that, what your specific role is well, it matters, but it's secondary in a sense. It's really showing what you actually do every day that gets assessed. So yeah, Chris.
Oh, okay. And that.
Yeah, I just wanted to add to that. So it's also about having the knowledge as well, because we know that some people, what we're seeing in certain professions, not so much public health nurses, but other professions in other areas are coming out and thinking health promotion is just about promoting health, and we know that it's so much more. It's about policy development, it's about advocacy, it's about planning, needs assessment, all those skills that we need. So I know that in the U.S., people actually can apply if they're a nurse or if they're even a social worker, they can apply and become an accredited health promotion professional, as long as they demonstrate what you had said around showing that they understand and they also have the skills in performing those competencies.
Yeah, I want to really endorse that. From my experience, I just finished leading an editorial team to produce a book on health promotion in older adults, and I was blown away with the number of professional groups that are actually doing health promotion work and actually have some training in health promotion areas. Gerontology is one of them, but there were a few others that were able to write chapters, very knowledgeable chapters that fit into a health promotion framework.
And so it relates a little bit to the next question around, types of workshops and training that might be required to recertify. So across professions, and how would someone actually demonstrate they've got that knowledge and expertise?
Can you repeat that, Dianne? Sorry.
No, sorry, and maybe it's already been covered, but what types of workshops or training would be required to recertify? How do you demonstrate that you've got that knowledge?
I know I can just answer to what I know. Within the core competencies that I had to show that I practiced, so when I got training, that training existed within one of the core competencies. So when conferences or training or workshop apply to NCCHEC in the States, they actually have to show that it meets within one of the core competencies. So it might be evaluation and the in-depth of evaluation planning, or it might be doing needs assessment and the in-depth or advocacy work. So those kinds of things, and you just apply and points are given, and then you apply and you show that you give your certificate or whatever, and then they apply those points. I would assume it's pretty well the same, Leanne?
Yeah, there's not a rigid sort of point system, but yeah, we do look at a range of different activities and trainings and try to evaluate, overall, has this person made taken steps to continue developing not necessarily all, but some of the core competencies of health promotion. And, so if it's not a well-known training, they might be asked to provide some supporting material like a table of contents or a schedule just to show, you know, what topics are being covered. But there's no rigid requirement around what that training is. Now, I think that perhaps in Australia and Ireland, the organizations themselves provide training that are directly linked to those competencies. So that's a little bit different when you have your organization and your NAO supporting that skill development, that competency development, then it can work, you know, then it's sort of easier to dovetail everything. But our system looks more broadly than that, you know, just what's the intent and what did you actually do? And, you know, are you continuing to build on these competencies in ways that you can demonstrate? And if yes, then it's, you know, it counts.
Yeah, I think I read in Ireland and Australia. I know there's somebody on the line from Australia, so they might want to type it in their box that you need 75 credits to recertify from year to year. I think it's,
yes, I don't
know who the lady is from Australia.
Mm-hmm.
There's actually two. We have.
Oh, we don't provide training. Okay, I think then it must be Ireland.
Oh, yes,
one of them
Gemma Crawford. Oh, Gemma Crawford is there. It's nice to see NTL Lockwood. Okay, that's excellent. Nice to see you. Nice to see you here.
That's great.
Oh, okay, that's what they do. Okay, 75 hours. Yeah, okay. Similar to the United States one. Yeah.
Yeah, wonderful. And so, you know, another question is, and this is a good segue. Let's pretend accreditation happens, right? It's going to happen, and it happens tomorrow. How long then would we expect it to take for it to be integrated within the system? As you know, going back to that question about, you know, organizations valuing it, picking it up. So, how long until it's required as part of jobs? Positions, how long until it's really recognized by the system? And is there any other concrete experience that can be shared?
What I know from reading the book in the United States, they really set up a system, and it took quite a while. I'd say probably 10 years eventually to get the universities on board, the work sites on board. They had to develop right from scratch. I think it would be similar. I mean, I think your people from Australia could say how long it took. I know that Ireland started in 2017 and they're still going, which is a good thing. The other people, Leanne, folded, right, in UK and Estonia. It's probably a reason for not being self-sustaining. I don't know. That's why probably a business plan might be needed for it, and some volunteers. Yeah, that's what I've found in my looking at this.
So variable, right?
Yes.
Yeah. Okay. I've got a question here from someone who's a health promoter in private practice. Is there any experience or stories to share from other countries around the accreditation and insurance coverage for being a private practice health promoter?
I think that question would be more relevant in the context of a professional order, which is not what's discussed here, but maybe I'm misunderstanding.
Right, because accreditation and professional. So, you know, again, as a dietitian, I'm regulated by a college. It's a different process and a different designation, right? So there's not necessarily insurance needed for an accredited health promoter to practice, for example. Just so I understand.
Right. That makes sense.
Okay.
I think in the U.S., from what I've seen, Dianne, is that there are private people who are accredited, and that it would probably be on themselves to get their own insurance, and that it might add a little bit more, I'm just guessing, a little bit more credibility and integrity that they've gone through the process.
Yep. Yep. No, and that's fair enough, right? Okay, but the accredited, just, and this is my own question for clarification, let's pretend Health Promotion Canada became the accrediting body, or FAC, or PHO, or other OPHA, any other organization. They wouldn't then have to provide an option for professional practice insurance. That's not obligatory with the accreditation process. Is that?
Not from what I gathered, but
no.
Leanne, I don't think so. But.
Sorry, I was typing something in the general chat box. I missed
okay,
that.
no, that's great.
Sorry.
That's great. Thank you. Thank you. Oh, sorry. No, just I was just asking for my own clarification. So if an organization was the accrediting body for health promotion or health promotion practice, they do not need to provide an option for professional practice insurance.
Not within our system. Not within our system. Okay. And just while I have the microphone, I just want to say that I put in a link to the chat for more information about our system, and there you have the requirements. Because some people are asking about the actual process, but all the information is there. Whether you're applying for a course or as a practitioner, you can go and look through it. You're quite welcome to write to me if you have further questions. I think some of the information on our website can be quite dense, but I'm happy to answer questions, more specific questions, if people have them along the way. And people can register, can apply to register as a practitioner now, even if there's not an accrediting body within Canada. Like I said before, if there is one, we direct you to them. But if there isn't, we take care of it globally for at the Secretariat. So we process requests from all over in areas where they don't have that national accreditation organization.
Okay, and we have one last question, which is actually a really great way to sum things up in terms of what we were getting at here. Is there a plan? Is there interest for Health Promotion Canada as an organization to pursue accreditation process for health promoters in Canada? Is that a planned next step?
I can answer that. Yeah, I think there is a feeling that Health Promotion Canada could become a national accrediting organization, but there's some hitches in that wish to do that. In that the cost of doing it is an issue, and having the person power to make it work is sort of an issue as well. So we think it's important that there be an accreditation organization in Canada, but we may want to do it in partnership with some other organizations, for example, CPHA, rather than take the whole burden on our backs, given that we're pretty much totally a volunteer organization.
Yeah, I know there's great passion among the members and among the executive at Health Promotion Canada for this and to further the discussion. So I've just put my email in the chat box, and in case people couldn't access that sign-up form, if people are sorry, if people are interested in becoming involved in the Warning Electricity Forum, I've asked them to get in touch with me, and then I can forward contact information on, because you know, I'm seeing comments around Australia has really done it largely with volunteers, and I think it really takes that dedicated professional body who are really passionate about it to move something like this forward. So yeah, so hopefully this will encourage people. And with that, you know, we're at time, just like that. The time got eaten up, and we had, you know, great comments in the chat box and great questions that really actually challenged me to think of things in a very different way.